Hello, today I will be talking about high-rise syndrome in cats. What is high-rise syndrome? High-rise syndrome is a term used to describe a common set of injuries that cats suffer after falling from a significant height, usually from the second story of a building or higher. Why is it called high-rise syndrome? Well, it's because it's most often seen in cats that live in apartments or tall buildings with an open window or balconies. And even though cats are usually known for landing on their feet, that doesn't mean that they are safe from these injuries. The impact from these kinds of falls can cause serious trauma, especially when they fall onto hard surfaces like asphalt or concrete. Cats that experience high-rise syndrome often show clear signs of injury. Some of the most common symptoms include difficulty breathing, panting as seen in this picture right here, broken teeth or bleeding from the mouth, a drop in their body temperature, lameness, swelling, or pain as seen in this image right here, and finally, many cats often go into shock or suffer internal injuries that aren't immediately visible. These injuries can be life-threatening if not treated right away. When a cat is brought into a veterinarian after the fall, the diagnosis is mostly based on the history of the fall, meaning how far they fell and what surface they landed on. A vet will perform a physical exam to see for any physical injuries. They will then perform an x-ray to check for any broken bones, and sometimes they will do an ultrasound to check for internal bleeding. The most common injuries are found in the fractures in the leg or pelvis. As seen right here, we see a femur breakage right here, but also another pelvic breakage right here. We see a jaw fracture, which right here you can see there is a tiny breakage right here, but then a major one right here, and this one probably resulted in bleeding from the mouth. And then the final one is a thoracic/chest injury. We can see right here, this is probably caused from a pneumothorax, and the cat probably suffered from a high jump and punctured its lung. Data collected from studies on high-rise syndrome shows some interesting trends. The majority of affected cats were European Shorthairs with an 81.2%, while the rest of the other cats have only an 18.8%. This is significant as there is more European Shorthairs with cases of high-rise syndrome than any other cat breed. This graph shows the weight distribution among high-rise syndrome in cats. 4.4 to 8.8 pounds has a 427 cases known of high-rise syndrome, with behind it leading 8.8 to 13.2 pounds with 387 cases. This graph right here shows the month distribution of a year in cases of high-rise syndrome. Most of these graphs are from 2014 to 2023 cases, so these aren't technically from 1 year, but it's from those years combined. We see that January and February have only 20, 22, and 38, but shooting up to 201 in July, but then going straight back down in the winter months. This tells us that cats are most likely active during the summer months due to the fact that they like to be outside, and those are the times that are the most precious to them. We also see right over here, these are the timing of days for cats of high-rise syndrome. We see that in the mornings and afternoons, they're most likely just 125 and 123 cases, but then shooting up into the evenings and nights, we have 271 with 371 in the nights. Evenings only have 271, mainly because cats are most nocturnal during the night, but they are also nocturnal during the evening, so this is why this also has a high number of cases. This graph over here shows the distribution of falls by floors. We see that less than 1.5 floors only has 137, but we shoot up quickly for between 1.5 to 2 floors with 245 floors. And with 2.5 to 3.5, we have 348 cases. And then most of the time, it gets lower and lower. We can see that most cases are between 2 to 3 floors, which is the most common that we see high-rise syndrome in cats. This final graph over here shows the distribution of impact surfaces. We see that asphalt has 137 cases, while only awnings have 1 case. Lawns also have a significant amount of cases with 25, with being the second highest cases of high-rise syndrome. Treatment for high-rise syndrome usually starts with stabilizing the cat and managing their shock. Most cats will go into a shock right after a huge impact. So vets want to make sure they stabilize the cat, making sure that it is completely relaxed before they go in and make sure there are no other injuries. If there are injuries, such as a pneumothorax, oxygen support is often needed, and many cats are hospitalized and put into the ICU for observation. This picture right here shows a cat having an oxygen support, probably due to a pneumothorax. The cat also will undergo 24-hour post-trauma, and this is a time period where vets will be fixing their orthopedic injuries. Finally, there is possibility for a feeding tube, and this will be temporary until the head/facial injuries are healed. This image right here shows a cat having a feeding tube, most likely due to a jaw fracture. The cat will have this feeding tube for a couple months until the jaw is at least healed a little bit, just so that they can start eating wet food, and until then they will have that feeding tube and they will most likely be on wet food for the rest of their life. The best way to prevent high-rise syndrome is through simple safety precautions. For indoor cats, owners should make sure all windows are closed or have a sturdy, secure screen that the cat cannot push through. Balconies should be kept off limits unless they are enclosed with a catio or other protection structures. For cats that go outdoors, it is most important to have a window lock and a safe outdoor space that are escape-proof. Regularly checking in and making sure screens and barriers can also make a big difference in preventing accidents. Overall, high-rise syndrome is very serious but also very preventable. With a few small changes at home, cat owners can greatly reduce the risk of these dangerous falls and keep their pets safe and healthy. Thank you.